We're ready to go with another episode of Across Louisiana Acadiana Style, brought to you by Mellow Joy, the original Cajun coffee. We're pleased to welcome today Dr. Louis Salvaggio from the Cardiovascular Institute of the South. Welcome.
Thank you very much for having me.
A little point of personal privilege. 2.5 years ago, I weighed 240 pounds. I now weigh 175, and it are the folks at CIS that helped me look at my heart and show some early blockage and change my diet. So it is working. Thank you guys so very much.
Congratulations. If we get more patients to do what you're doing, it could save a lot of clinic appointments and money, I guarantee you.
Well, we are here today to talk about quitting smoking, and my wife Nyla quit 1.5 years ago at 50, made a big difference in her life, and of course you guys are trying to help everyone. So about the program.
Well, as a world-class leader in cardiovascular disease prevention and treatment, Cardiovascular Institute of the South, or CIS for short, stresses on the importance of risk factor modification and knowing your risk factors so you can modify them. And as we all know, smoking is a huge risk factor for coronary artery disease and stroke. So what CIS has done is we've partnered with the Smoking Cessation Trust to provide the community and the people in our community with a means to try and stop smoking.
Yeah, I noticed in the brief that you sent over that you're involved with helping people who started smoking prior to 1988. I assume there was less knowledge of the dangers back then?
Much less knowledge, but part of the agreement with the Smoking Cessation Trust is you have to be a resident of Louisiana and you have to have started smoking before September 1st of 1988 to qualify for the program.
Okay, so it's a free program, but what is the program? How do you guys help?
Well, the program was designed to provide people in the Louisiana community with free medications, both prescription strength and over-the-counter, and free counseling to help people stop smoking.
Okay, and so kind of walk me through a little bit about if I'm a smoker, how long is it going to take? What are you going to ask me to do?
It's different for everybody. If you're a smoker and you're interested, you sign up for the program, and we'll go over that shortly. And we have you come into the office and offer you a counseling session where it's one-on-one with a physician. We try and figure out if there's anything that you've used before, whether it be a nicotine supplement product or a prescription strength medicine. And if it worked in the past but you stopped it because of cost, we'll try that again. If it didn't work for you, we'll try to avoid that medicine and go over some simple steps to try and help you go through it. It could be as little as a month or as much as 6 or 9 months, and it's individualized on each patient.
Okay, well, tell me in layman's terms, kind of what smoking does to you from your perspective. What does it do to the heart?
Well, it does a lot of things to the heart, but in addition to that, it increases your risk of lung cancer and lung problems. The big thing that we worry about with smoking is that it affects the blood vessels in the entire body. It can make the blood sticky. It can make you form plaque in any of these vessels that supply vital organs, so it increases your risk of stroke, heart attack, and peripheral arterial disease.
Well, I mentioned Nyla's age. I'm probably in trouble. She quit at 50, but they told her it's never too late. Quit, just quit as soon as you can.
That's absolutely right. It is never too late to stop smoking. In fact, I've seen a patient recently in one of these smoking cessation visits that was 80 years old when she decided to stop smoking. And she stopped after a successful 3-month completion with the program. She's very happy. Stopping smoking reduces your risk of stroke and a heart attack substantially. Up to 5 years after stopping smoking, you can decrease your risk as much as 50 to 70%.
Wow. Okay, let's get the contact info, website, and phone number for folks to get a hold of you.
Sure. If you're tech savvy, you can visit us on the internet at smokingcessation.org/CIS, or you can call the 1-800 number, which is 1-800-425-2565. And after you registered for the program, you'll receive a packet in the mail within about 3 weeks after trying to register, and you can contact us for your first visit.
Okay, thank you. Good luck with the program.
Thank you.
We're going to take a quick trip down to New Iberia to one of the families that help Cox Communications keep this programming on. It's the folks at Arsenault Ford. Take a look.